This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good. How you doing?
I'm doing good. We have a great topic today.
What's our topic?
Our topic is upper body lift. And if you're out there thinking, upper body lift, what's that? You're not alone. This is a surgery that is kind of a conglomeration of other surgeries like mommy makeover or lower body lift. So if you've got issues with your upper body, below the neck, let's put it that way, below the neck and above the belly button, this might be the podcast for you.
Upper body below the neck.
That's right. Above the belly button, below the neck.
Above the belly button, below the neck.
We're talking about the up middle third. I don't know what you call
exactly.
that.
It's like your torso below
including
your
the
neck.
arms. Yeah.
Torso below your neck, above your belly button.
Yes.
Include your arms.
So let's jump into it.
So real quick, upper body lift was not a surgery that was defined when I was going through training.
No. And I mean, was lower body lift kind of was.
It was just coming out. There was this guy named Ted Lockwood. He was this famous plastic surgeon in Kansas City, and he's the one who came up with some of these body lifting techniques that became really in vogue and what we use now. Mm-hmm. But upper body lift, calling it that name, that amalgamation of surgeries was not around. Yeah,
I would say it is a newer kind of thought. Yeah. And a lot of it is because, as we'll talk about, a lot of these surgeries are performed after massive weight loss. So
right.
We've talked a lot on the podcast before
bariatric surgeries became in vogue in the past 15 to 20 years, I see. Okay.
And how some of that impacts the surgeries that are happening now. In our podcast a few podcasts ago talking about plastic surgery statistics for 2019, we brought that up. And if anyone is interested, there are a few slides that go along with this. You can find those on our YouTube channel at Jason Martin MD. Not a ton of slides this time, but some slides.
Right.
Yes. So are you ready?
I'm ready.
Okay. So as with most of our procedural videos, we kind of go through it. We talk about the statistics. We talk about who's a candidate, recovery, other considerations. So if you want to jump to any of those, just check out the description below and you can find the little timestamps for those things. So first, let's talk about the statistics.
All right, let's do it.
So I had Sarah put in the statistics for mastopexy or breast lift and upper arm lift. Now, the other thing that is kind of considered part of an upper body lift is what we call a bra line backplasty. There are no statistics for that. Backplasty is not something that is being...
I feel like I came up with that name.
Backplasty?
Did I come up with that name?
I don't know. Maybe. Claim it. TM it.
I know. I should. Trademark. Yes. Nails on it. Because I remember when the first time we did this, she goes, "What's this surgery called?" I go, "Well, it's really not a surgery, but like obviously you have extra fat and loose skin that goes across your bra line or that area of your back if you're a man. And if you lose a lot of weight or if you have certain type of skin conditions or et cetera, there's no other way to get rid of it besides an incision that goes all the way across your back, horizontally speaking."
Yeah, bra line
backplasty. It's a backplasty. It's a backplasty. Yeah. So I'm saying that was my surgery to begin with.
Write a book, quick. Okay. Get that in the literature.
Everyone buys books these days, Amy.
Well,
that's a venture I want to get into.
Digital book.
Okay, yes. Digital book.
So the statistics we're looking at are from 2019 because that is the most recent year that we have statistics for at the time of filming this podcast. So in 2019, there was about 113,000 mastopexies or breast lifts, and upper arm lift or brachioplasty, there were just over 18,000. So not a ton.
Right.
These are not the most commonly done procedures, which is interesting because they're some of the more common procedures that we tend to do. We do a lot of arm lifts. We do a lot of mastopexies.
Yeah, it's weird. We do a lot of brachioplasties and we do a lot of breast lifts.
Yeah. And maybe that's just our demographic.
Actually, as I stated, I created the backplasty.
Yeah, we've actually done quite a few of them.
We've done quite a few of those. Yeah. So those in combination, if you imagine your trunk circumferentially all the way around, including your arms, above your belly button, below your neck, imagine all the areas you could address, which are going to be your breasts, and even men need breast lifts. It's going to be your back in that area. And then if it's extreme amount of skin looseness, you'll need a backplasty. And then, of course, your arms. Everyone knows the bat wings. They've had grandparents that have the shake the elbow back wings.
That's right. The bat wings.
Which can happen even in people of younger age.
Yeah. So that's kind of what an upper body lift is. It's a combination of surgeries that are addressing the arms, the upper part of the trunk, and the chest.
It's kind of cool, so you're addressing basically, 25% of your body at least, all in one surgery. And
areas that are somewhat harder to hide. I think a lot of people find it a lot easier to hide their legs, hide their abdomen. When you want to wear a tank top, all those areas are potentially going to be visible. Or working out, if you have, arms that are really cumbersome and in the way, or you have fat that's hanging over your sports bra and it makes you uncomfortable. It really addresses a lot of concerns that are more at the top, of people's mind usually, and things that are going to be visible. With those do come, some scarring and some other things. So discussing who's a candidate for these procedures, like you said, it can be men or women.
Yeah.
Typically, we're going to do these procedures more on people who've lost a lot of weight, but not always. We've definitely done bra line backplasty on women and men, or women specifically who've never been overweight.
Normal weight.
Yep.
Haven't lost weight. Maybe had a pregnancy or two and still had a lot of excess skin and soft tissue there.
Yeah, like a lot of laxity, like that you can grab. And that's something to consider with this area, though. And what we always have to tell these patients is you will always be able to grab something. Because if you can't, it also means that you cannot lift your arm over your head.
I remember that conversation. So this lady came in and she really wanted all the back skin and fat off her back.
Because she kept reaching back and she's like, I can still grab it. I can still grab it.
She goes, I don't want anything that you can grab. I'm like, well, if you ever hunch over, like kyphotic kind of, if you got to watch our YouTube channel, I'm hunching over for the audience. You hunch over, like you won't be able to do that. You wouldn't be able to basically move your back.
Or put your arm up over your head.
Or put your arm up over your head.
Yeah.
And she was like, she literally said, okay.
Yeah, she didn't care. I'm like, how are you going to get dressed? You were button-up shirts your whole life?
Sounds good to me. Sign me up, Dr. Martin.
Button-ups. That's the only way. You never again put a shirt on over your head.
I've noticed that you don't lift your elbows above your shoulders. What is going on with you? I had a backplasty by Martin. I can't move my back.
That's right. But it's fine because I can't grab anything. I mean, it's unrealistic. Same thing with any type of surgery, a facelift, a tummy tuck. Your skin has inherent elasticity. It's good. It's also why it bounces back. You can pinch some skin anywhere on your body. So to think that you could ever do a surgery where you would not have pinchable skin is unrealistic.
Right.
So,
but we did do the backplasty on her. She had an amazing result. Looks really good. One of the things about the backplasty, and we'll probably get to this in terms of the scarring, is the scarring. And that's the same thing with brachioplasty or arm tuck or whatever the layperson term is. And then breast lift, which we call a mastopexy. I mean, all three of those surgeries, which comprise this upper body lift, the main issue or concern for most people is scarring.
Yep.
And so we'll get to some of those things with the surgery. But you're trading one issue for the other. And in our experience, the scars are nowhere near as problematic ever as the issues those people are having to begin with.
As the skin. Yeah. And if, like some of our patients said before, like people can see the skin.
Right.
So.
Yeah. I also remember a patient, same kind of issue, didn't do the backplasty, but had really bad arms, weight loss patient, very saggy breasts. It was really bothering her. And I remember her main issue was not even the breast, even though she did do it, was her arms. She was of a fairly normal weight, but she couldn't get her arms in a workout shirt because there was so much extra skin there that she couldn't get clothes that would fit snugly up top because she could wear a bra to push this up. She looked pretty good otherwise. Her arms were just the biggest problem.
Yeah. Something else with the brachioplasty component that we probably covered on our brachioplasty episode was talking about like an extended brachioplasty that kind of extends onto the back. And that's definitely another option too. Like you can do a backplasty by extending the incision from the breast lift. So you extend it across that way, but you can also kind of extend the scar down from the arms and pull it that way.
Right. The brachioplasty incision gets extended through your armpit and goes down to the side of your chest vertically. And then the mastopexy or breast lift incision can go horizontally where your inframammary fold is or the base of your breast
or
out.
Where a bra would go.
Exactly where your bra would follow your bra line out. And so you could do it both ways and they can intersect. I've done that before.
Yeah. So it's definitely It probably sounds like scary at the moment. You're like, oh my gosh, this is all we've talked about is scarring.
Yeah.
So when we come back from our quick break, we're going to talk about more than just scarring. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right. So we've talked about all the scars, the areas that can be addressed, men and women. You're probably a candidate if you can grab some skin or flap your arms.
Yeah.
Let's talk about the awesome part. Let's look at a picture.
Yeah, the after. Mm-hmm. So if you go look at Jason Martin, MD, this is actually on my professional Instagram page too. This is a lady who lost a lot of weight, And we did a brachioplasty on her. But if you look at the photo on there, it's showing you that there's such an improvement along her back. Now, she is also a candidate for a backplasty. We did not do that on her because she didn't want it. But if you would have done a backplasty on her, you could have pretty much solved the problems of her upper torso and arms.
But this was just by extending that mastopexy incision.
Yeah, we extended it out. And then also we did do the extended brachioplasty on her, which you can't see. We should have the AP, the other view of that, where you could see where that scar comes down through her armpit.
Yeah, but it really shows you what an amazing improvement there can be. And that's what we were kind of talking about before, that this is an area that's really hard to hide yourself. You know, this patient was getting married, her wedding dresses it was really hard for them to get a wedding dress to fit because she had a lot of excess skin. So got rid of the skin on the arms, a lot of that skin on the upper back without having to do a bigger scar.
Yeah.
But you can kind of see where that scar ends. And, if you were to extend it further, you could kind of pull up on that.
If she would have allowed us, and she just didn't want it, which is totally fine, to go back all the way to the midline of the back on both sides, all the extra skin would have been gone. She would have had a totally flat back, which is amazing actually from where she started. So, really, in reality, it seems like Amy and I are jumping all over the place, but this is a very unique set of surgeries that are honed in to a specific patient base. And it's most likely people with pretty notable weight loss or people that really do have lax skin. And sometimes that's a condition, cutis laxa or Ehlers-Danlos. There's different types, but those are very specialized patients. And that's why you just don't go on the internet and you see, upper body lifts, right? But now that bariatric surgery or weight loss surgery is a lot more common, now that people are a lot more educated and empowered, partly because of this podcast, then you know that these things are out there. So these combination procedures, if you have really loose skin on your arms, that is enough to cause to need you to have to do a brachioplasty. It's not a stretch that maybe your breasts are fairly lax and droopy. And then it wouldn't be a stretch from there to think that you have laxity of skin and soft tissue that goes all the way around your torso above your belly button.
Yep.
So, I think that when you look at these pictures, you have to understand the baseline presentation of these patients. And if you're someone at home and you're just interested in plastic surgery and you're listening to this episode, say, I wouldn't put, incisions on my arms and my breasts and my back. Well, yeah, you would. If you couldn't wear any clothes, you couldn't, it affected your functionality. It affects your quality of life and your self-perception. 100% you would consider this surgery. So it is specific to their presentation more than anything else.
Yeah. And, talking about scarring, if you look at the picture that we have up right now, you can see little bits of her scarring on the sides. Yep. You can't see any of the scarring on her arm. And what can you see before? Tons of excess skin, so which one of those things does the patient find, more bothersome? I guess
it's anecdotal, but we can tell you from our experience, they love it. And this is I don't know. It's hard because, when you do this for a living, you get isolated, but because you're not sitting there talking to every other patient who went to every other plastic surgeon, but our brachioplasty patients specifically on the arms do not regret the scar on their arms. They really don't.
No, even the patient we have that did a brachioplasty years before she met us that is literally straight down the back of her arm. So when her arm is down, you can absolutely see the scar. It's in the...
It's the worst placement ever.
She doesn't care at all.
She doesn't care.
Does not care. Because you know what? Your scars are nobody's business at all. And does anyone really come up and be like, you have scars on both your arms? Oh, that's weird. Why? It just doesn't happen.
I'm sure somebody would do that in these days.
Maybe, but probably not.
Yeah, probably not.
Yeah. So, I think the scars is not as big a deal as most people might think they are. So let's talk about some post-op considerations, because we've talked about a combination of a lot of surgeries that could add up to, a fair amount of surgical time.
Right. So just real quick about the surgery itself. Can I just quick things? Okay. So the surgery itself is pretty extensive. Okay. So your arms take you about an hour and a half, breast lift with or without an implant, a couple of hours. And then a backplasty is going to take you at least another hour and a half. So you're talking about at least 4 to 5 hours of surgery for sure.
And that's hands-on time. So you have to consider too that there's a lot of prepping and redraping during this type of procedure, because you're having to be rolled. When we do the arm surgery, you kind of have to have your arms in a little apparatus that keeps them at a specific position. We redrape everything before we do a breast surgery to keep everything extremely sterile. So there is inherent time that you'd be in the OR that's not surgical time that would be added on to the total time that you were under. So for me, if I was booking this combination of surgeries without an assist, I would book it for 6.5 hours.
But then she knows that me being a superior surgeon would get it done in 5.5 hours.
Well, I know your hands-on time would be that, but I know there'd be time to reprep and drape.
Right. It is like so much stuff, so much work to get these patients maneuvered in the OR. Also in the operating room, it's just a lot of surface area, involves liposuction also. So and if you're listening to this and you're considering the surgery, so we said there's a specific group of patients that could benefit from this, and it's a smaller number of patients. You really should be admitted to the hospital, and here's why. When you do this large of a surface area of surgery, you can get something called third spacing. You can get hypovolemic or dehydrated. Mm-hmm. And if they send you home, there's no way that through drinking that you could probably get enough intravenous fluids or enough fluids in your system. So that's why giving you the intravenous fluids is actually really important. That's where this one night in the hospital stay is probably important with the surgery.
Yep.
If you're doing a brachioplasty alone or arm tuck, you can go home.
Yeah, mastopexy alone, you
go home. Right, backplasty alone with liposuction, you can go home. But all three, that's kind of getting over that threshold of admission. Now, some doctors may not, and that's fine. But that's what we do.
Yeah, and it's something to think about too, because you won't have use of your arms for several days, and we'll talk about that in more detail. But that first night, it's kind of nice to just be able to relax. Your caretaker doesn't have to be worried about you. You can kind of just use that first night.
Because it's probably a family member, and they have no idea what to do. They can't grab your upper body. You can't move your arms.
Yep.
Yeah, I'm not really sure that. You never know.
It's definitely worth just staying that first night in the hospital. Even all the other concerns aside, it's nice to get a little bit of a break before you have to go face reality.
Right.
So let's talk about drains. Everybody asks about drains. Will there be drains?
Yeah, most likely. Definitely with the brachioplasty there will be. Breast lift, we don't usually use drains. Some people do. Backplasty, it's probably smart to put drains in there if it's a big surface area.
Yeah, and especially with the arms, and we talked about this on our brachioplasty episode, it's kind of a small area and we're making it tight, right? We're making it smaller and tighter. So the last thing you want is to have just really bad swelling that puts pressure on that incision. So the drains may seem really super annoying, but with a brachioplasty, the drains are not in for very long. They're usually in for 3 to 5 days.
Right.
They're not in long, but it really, when you see how much comes out of them, and I think that's what surprises people.
What is it about drains? Why is drains always such a
Well, I think it's just because you have to see it. People are squeamish. They don't want to see it. It's, like, where's it going? It's the same thing that freaks out IVs. People are freaked out by an IV. Like, where's it going? Like, oh my gosh, it's going to break off inside me.
Right.
So it's, someone has to empty it. Like, it's gross. Like, it's a leash.
Yeah, you can see blood.
It hurts. Yeah. Yes. So I think there's a lot of reasons. But the drains with the brachioplasty are only in for a few days. It lets all that fluid come out. You're actually going to be a lot more comfortable with the drains in. Something that can happen, if you don't have drains, or even in cases where you do like really aggressive liposuction on the arms, because that fluid kind of has nowhere to go. Where does it go? It goes down, which means that your hands get really swollen, like uncomfortably swollen.
If you get
everything.
Carpal tunnel, like if you have carpal tunnel already, that'll get worse. Yeah. Your fingers can be like really tingling.
Puffy. Yeah.
Yeah. And that's an issue. And definitely on the back, especially when you do the backplasties, just the movements alone can cause tension and tightness and discomfort. This is kind of an extensive surgery. Would you agree with that?
It is.
Yeah.
Yep. It's very tolerable. It really is. Like, arms are really mobile, so swelling doesn't tend to be super persistent, which is good. Those first few days, it's going to be, that's why the drains are there. Once they're out, like, your arms are, able to move still. So it helps. You're more mobile. Your legs are obviously fine if you didn't do any other surgeries. So as far as your ability to get around is very good, as opposed to like a thigh lift where that's the challenge.
It doesn't seem really as painful as some of the other trunk core work.
Yep, that's true. Yeah.
So people tend to tolerate it more. It's on a scale of 1 to 10 in pain. It's not a 10. It's like 6, 7 range.
Yeah. It's definitely a lot, pretty easily tolerated, even though it is a lot of surgery. So one of the main things to consider, I think, with any time you're doing like a big group of surgeries, it doesn't mean that this is it, like that this will be the only thing you need to address all of these issues. As you saw in the picture we showed, did this completely get rid of all of the issues that she had? No. She could still benefit from additional surgery. There may still be additional skin tightening that needs to happen.
Especially with weight loss.
Yep. There's a lot of things. So while these things can all be done in one surgery, and it's definitely very appropriate to do them all together, that doesn't mean that you might not need additional surgery in the future.
Right.
Or that it's going to solve absolutely everything. They can address a lot of things, but you may still need additional surgeries. And that's with any surgery, is an important thing to keep in mind. Like, at some point, you may need additional surgery. you will definitely need some time off work. And I put up to 2 weeks because depending on what you do, you could be back to work very quickly after this procedure. I mean, if you do something even where you can adjust your workstation and just use your arms like a T-Rex, you'll be back to work in a few days.
So if you work for FedEx or you carry bricks for a living, you're not getting back out there anytime soon.
Or if you work at a daycare or you are a healthcare worker where you do transfers, where you're having to lift or stretch and lift especially.
I mean, that might be...
It could be a month.
Yeah, 4 weeks. I was about to say 4 weeks.
Yeah. So there are definitely restrictions that you would have with this surgery for an extended period of time. And restrictions doesn't mean that you're bedridden. It just means you'd have restrictions. And I think 4 to 6 weeks is a good thing to keep in your mind of like, when would I be back to doing everything? 4 to 6 weeks is a place to start. But I would say, and I always say this to patients, like at 6 weeks, don't go do pull-ups.
Or
that might be longer.
Don't get your CrossFit on.
Right.
For sure.
There are things that you kind of have to be smart about for an extended period of time. And that's the investment that you make in surgery. And we talk about that all the time, that the cost of surgery is
not just financial.
Way more than financial. It's, so.
Do they really, are you listening to us, people? Right. Are you listening?
It's more than the money.
Right. With that, so this is a big investment, a big recovery. You want to do it the right way so you don't ruin what you did.
Yeah.
That's basically what it comes down to.
You'll have you T-Rex it. If you're watching, you can see my T-Rex. If you're not watching, just think if your elbows were attached to your sides and you could move your forearms and your hands, and that's it. So T-Rex cannot do push-ups. Everybody's seen that meme, right? T-Rex can't do push-ups. T-Rex also can't clap, but so anything that's happening above your head, including putting shirts on over your head, putting giant, big, heavy pots. I remember, the patient who was upset with me after her mastopexy because she had a big Italian family dinner planned and she could not get her pasta pot off the shelf and had to get somebody to come help her because I told her in no uncertain terms, should you be reaching up above your head for a heavy pot? She was very unhappy with me.
Very unhappy with you?
Very unhappy. This was not a mild...
Again, we should write a book with all these stories in it because it would definitely sell.
Very angry.
We could just break it down by procedure and then tell the stories associated with that
This
procedure.
is when I made someone mad. So, you're going to have to be T-Rexing it, man or woman. This is the same advice. No shirts over your head. Zip-ups and hoodies are going to be your best friend for a couple of weeks. Now, once those restrictions are lifted, does that mean you can go to the gym and start doing push-ups and pull-ups? No. Obviously will take you some time to ease back into everything. But time off work, time where you're in discomfort and pain is really only those first few days, where you might still be taking prescription pain medication or a little bit of Valium to help with some of that tightness. After that, you have the restriction of T-Rex, but T-Rex can get a lot done.
Yeah.
T-Rex can be pretty active. One thing that you may not think about if you have this surgery or any of these surgeries, any one of these surgeries, do not reach out to grab a really heavy car door the day after surgery. Yeah. That's the one that gets everybody.
Or it's always something with the dog, grabbing out with the dog.
Dog leash.
The dog saw a squirrel and was running after it, and I had to grab the dog. I'm like, let the dog go after the squirrel.
Yep.
Who cares? I mean, God bless the squirrel, but your breasts are more important than the squirrel's life.
Your arms.
My opinion.
Yeah. So.
Do you agree with that, Nils?
It's those little things that people don't think about, though, because it's just such an ingrained thing. The car door, I'll get that. So I always tell the person's caretaker, please do not let them close their own car door. Because it's always a big SUV or something that they reach for and they call me crying, oh my gosh, I felt it. It was ripping. I've undone everything.
Yeah.
So there are a lot of considerations, but not, it's really not, like we said, not really painful. A little bit of time off work, a little bit of time T-Rexing it, and you're back to normal. So. Any other considerations?
Yeah, well, how long does it last, Amy? I mean, that's always the big question.
Oh, the surgery itself? How long do your results last?
Yeah.
So as long as you maintain your weight, your results with these surgeries really should last forever. Now, that, as we always say, does not mean you won't have normal aging, and specifically women with breast aging. If you have this surgery when you're 30, you're going to need another breast lift in your life if you care. Your breasts will continue to age with the rest of you.
And they can change. Sometimes people that need lifts then do augmentations later on, et cetera, et cetera.
Reductions.
Or reductions. So, but yeah, I mean, just a long, long time. These surgeries last a long, long time.
Yeah, it's rare that we've ever redone a brachioplasty.
I've never.
Nope. And aside from the person who didn't want to put her arms over her head, we've never had a patient even consider redoing a backplasty.
Right.
Once that skin's gone, it's gone. I mean, if you maintain your weight, these are not areas that tend to have hormonal fat accumulation, with the exception of the breasts. So arms and back, maybe you'd have some additional lipo there later, like we talked about, some additional skin tightening at some point in your life, but it's unlikely that you would ever have one of these procedures redone.
No. Yeah. I mean, even in situations where the scars aren't perfect, you can redo those in the office with really good outcomes. So I think overall this is a net positive. Again, upper body lifts, this is niche. I'm sure people that found this episode are probably actually looking for it, which is great. This is really an amalgam of surgeries related to, most related to weight loss surgery. So all these new increased incidence of patients with massive weight loss, greater than 50 pounds, 60, 70, 100,
And that can be pregnancy
pounds,
too.
and pregnancy related. But together, they're pretty amazing. Last thing I want to say, you can break them up, okay? So if you're sitting out there and you really want these surgeries and it's too expensive for all three, or you just don't have the downtime, you actually do work at FedEx or you do carry bricks, and you can only do one of the surgeries of the three, that's okay. You can do them in series, and we've done that before. I've done breast lifts, some people, and then gone back and done a brachioplasty. I've done a backplasty alone. There's all these different options that you have there. So don't feel like you have to do it all at once.
Yeah. But if you do work at FedEx and you're trying to avoid the downtime, don't break it up into 3 surgeries.
That's true.
Do it all as one. Take
if
your
you're
PTO.
working at FedEx, take your PTO and then your FMLA.
Yep. And then you're good to go.
And then you're good to go. You get your 6 weeks out of it.
Yep.
We got you.
Yeah. Awesome. Well,
All right.
Thank you so much, everyone, for listening. Again, if you did want to watch the video and the slides that went along with this podcast, you can find those on YouTube at Jason Martin MD. We still have our Google phone line open that no one has left me a message on yet, and I'm actually kind of sad about it.
Yeah, it's really disappointing.
Yep, that number is in the show notes, but I'm going to give it to you now just in case you really want it. Yeah. It's 303-630-9038. So if you do leave a message, you will likely hear your question on our podcast at some point.
We have had a lot of questions on our Instagram for Beauty and the Surgeon, which is great too. And we do really appreciate those, and we'll use those in upcoming episodes.
Yeah. So if you want to be featured on Beauty and the Surgeon podcast, leave me a voicemail. All right. Thank you, everyone, for your likes, comments, ratings, and reviews. We do appreciate it. It helps us very much get out to more people, and we will see you next time.
Thank you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.